There is a new push tonight to expand Rhode Island's medical marijuana program. In 2006, Rhode Island became the 11th state to legalize medical marijuana. Under current law, participants registered with the Department of Health can buy up to 2.5 ounces of marijuana or grow 12 plants. But advocates say some patients need help getting access. NBC 10's Leslie Urancian joins us now with both sides of this medical marijuana debate. Leslie?
Patrice, right now, Senate's hearing a bill at the State House that would allow the Department of Health to let a nonprofit organization grow and distribute medical marijuana to licensed patients. Opponents point to a national survey that says Rhode Island has one of the highest marijuana usage rates among young people. And now is not the time for this bill to be passed. We caught up with 3 people who are using marijuana for medicinal reasons that couldn't disagree more.
Having to be able to live with AIDS, HIV, that's the hardest part.
Bobby Ebert is living with AIDS and smoking marijuana to curb the pain.
It's changed my outlook towards life. I'm living with AIDS, and I can smile and just say that, I'm happy with my life. I'm happy in my skin. I don't hate myself.
Bobby Brady Cataldo has multiple sclerosis. She was the second patient in Rhode Island to get this license back in 2006, a license that lets her use marijuana for medicinal purposes. And Mary Ann is coping with fibromyalgia. She smokes marijuana to kill her pain.
It helps my nervous system to calm down so that I can do basic things like that. Otherwise, I would just be in bed all day in pain.
All 3 patients we spoke to say the same thing. Before they started using marijuana for medicinal purposes, they were popping painkillers and prescription drugs, gaining weight and feeling numb.
Patients are being given drugs like Oxycontin and Vicodin that are known to be much more addictive. We'd rather see them relieve pain and suffering like chronic pain and nausea and vomiting through the use of marijuana.
Right now, more than 300 Rhode Islanders are living with various diseases and licensed to use marijuana for medicinal purposes. But many of them want this bill to pass so that they can get their marijuana from a regulated state center. They say that way they don't have to depend on a caretaker and variable crop production.
It's different strands of marijuana, and some of them are good for inflammation, some of them are good for severe pain, some of them are good for all different symptoms. And this way you can actually go and you can try the different kinds of strands to see which one works for you.
We spoke to the Rhode Island State Police to get their response on this issue, and they say they prefer to remain neutral. We'll keep you posted on the status of the bill. Leslie Urancian, NBC 10 News, live in the newsroom.
Thank you, Leslie. It's surprising what the government knows about us, what we eat, Tostitos.
To expand Rhode Island's medical marijuana program, advocates say some patients need help getting legal access to the drug. A bill in the Senate would allow a nonprofit organization to grow and distribute pot for pain relief. From the NBC 10 Fact Finder tonight, under Rhode Island law, patients registered with the Department of Health can buy up to 2.5 ounces of marijuana or grow 12 plants. Medical marijuana remains illegal in Massachusetts and under federal law. Massachusetts Congressman Barney Frank plans to file a bill to decriminalize small amounts of the drug.
A local